Hey guys, Dr. Castillo here again with Spanish Chiropractic Success. This video was a request, and I'll go through an example and you'll understand exactly what the content is going to be for this video. So you know how you're doing your day one and you ask a patient like, hey, like where do you hurt? ¿A dónde te duele? And then they point to it. Let's say it's like low back pain. And then you ask them like, describe el dolor, right? Describe the pain. You're gonna get a lot of responses, okay? And in some instances, you're not gonna be able to understand specifically what the quality of pain is, but hopefully by the end of this video, you'll be able to understand what to look out for when patients are telling you how, like when they're describing to what their pain actually is. And I know we've used, like in the past, you know, like if you remember when you were studying anatomy and physiology, you'd have flashcards, you know, back and forth, and you'd be able to just kind of rapid fire. I want you to view that kind of concept within this video. I'm going to be rapid firing different types of descriptions so that you can listen for them in the future, and then you know, oh, okay, I know what that means. I know what that means, okay? So we're just going to go right from the beginning here. So they might say, me duele. Right? Me duele. That means it hurts me, right? It hurts me. There's pain. They might say me entume. Me entume means it's like a numb inside, a numbness inside. And there are other words for that, so we'll go over that in just a bit. Me quema, or una sensación de quemando o quemarse. That's like a burning. Anytime you hear the word quema or quemar, that means to burn. You can hear the word, sometimes you might ask them like, hey, I don't, ¿cómo te duele? Like, describe el dolor. They might say, oh, doctor, yo tengo un hormigueo aquí en mi espalda, which means tingling, right? Usually they'll point to like the leg, bottom, like maybe the top of the leg here or the buttock, because they're like saying, oh, there's pain, but then it tingles down here. Like un dolor corriendo, it's like running. Corriendo is technically running, but they'll say like, el dolor corre así, right? They'll say like it goes down the leg sometimes. So hormigueo would be tingling. Me duermen. They might say like it's like sleeping. So like my back is sleeping, or my leg is sleeping, or my arm is sleeping. Me duermen. The root verb is dormir. Like if you were to Google it, like dormir, dormir. That's the root verb is that the explanation for that would be to sleep. So duermen, like if it would be like two legs sleeping, like, oh, ellos me duermen, like it feels like they're sleeping. If it's a sharp pain, like sometimes I'll actually go like this too, like I'll ask them like, ¿tienes un dolor con piquetes? And then they'll say like, sí, doctor, tengo un dolor, me pica aquí, which means like it's sharp, it like pokes me right here. And then kind of like as an overall encompassing word that people use, this is kind of like a bonus, an overall encompassing word that people use for like, this is it's a horrible pain. People will say, es un dolor, doctor, es un dolor feo. And basically feo is a description for ugly. Like if you were to say like, that picture is ugly, you would say feo. But it can also be used as a describing word for pain, which means like nasty or awful. And so it shows up as a description for pain, and also for like normal day-to-day talk with like describing like that thing over there, you know, which is interesting because, you know, we wouldn't really say that in English. Oh, my pain is ugly. We would say like, oh, I have this awful pain. That makes sense. But I don't know, just really interesting when you can balance kind of like the English-Spanish translations. So just to remember, this is kind of like rapid fire moment. Me duele means I hurt. Me entume means it's numb. Es un dolor quemando, or me quema, means it burns me. Hormigueo, tingling. Durmiendo, or duermen, or duerme. Anytime you hear duerme, duerme, that's sleeping. Piquetes, or me pica, that's sharp. And then dolor feo is nasty or awful or super big. It's a super big pain. It's really, really bad, awful, nasty. So hopefully you guys got a little bit out of that. I'm just gonna end this video now just so you have it short and sweet. These are descriptions for pain. Have a great day, guys.